So, Dr. Jones, what inspired you to write Injectable Fillers?
The whole world of injectable fillers is growing extremely rapidly. From 2000 until 2010, we have seen the filler market grow from just a couple of fillers to now well over 10 to 15 fillers that we will have in the U.S. market in the next year or so. The world changes very rapidly each year in terms of the number of fillers that are brought into the U.S. marketplace and the European marketplace. So it's always a changing game, so we really have to update our knowledge base routinely. So that was my inspiration, was to basically edit a book with the leading minds and writers and researchers and thinkers in this field, and have a very comprehensive book on the how, why, what, when, where about injectable fillers, and I think it's a very nice piece.
And what do you think readers will get out of this book for their patients and for their clinical practice?
I think whether it's someone who's a novice injector who has never injected, or someone who may be a very experienced injector, we go through each chapter looking at each individual filler from A to Z, the basic science of the filler, the pivotal trial data, the science behind the filler, and basically how to do it and get the best patient results that are very predictable. There's also a CD with the book that shows you how to inject properly and get a good result.
Excellent. And what do you generally see as the future for dermatology?
Well, dermatology is a very exciting specialty these days. We are seeing increasingly sophisticated new devices and technologies that are coming into the marketplace every year. We can do phenomenal things with the botulinum toxins now. We have a whole palette of fillers that we can use to produce really fabulous results. And then we have really wonderful new types of therapies that are coming out left and right in dermatology, so it's an exciting field to be in.
And what made you want to be a dermatologist?
Dermatology is really the perfect blend of medicine and surgery. And luckily enough, when I was going through my residency back in the late 90s, we saw a blossoming of cosmetic dermatology. So I've been fortunate enough to participate in many of the studies that have led to the approval of all these wonderful fillers and toxins that we have in the market these days. So it's a wonderful blend of both art, science, and medicine.
Excellent. And so if you weren't a dermatologist, you'd be?
If I was not a dermatologist, I would be a concert pianist, and I would be probably very poor.